Hi friends, I'm gonna go live hopefully every week or every 2 weeks maybe, and share some of the things that I've learned over the years about gut health primarily, along with other topics related to baby development and things like that. And the reason that I'm so passionate about talking to people about gut health and nutrition for our kids is because of our personal story and what we have experienced as a family the last few years. So tonight I wanted to tell y'all a little bit about that story. For those of you that don't know, a lot of y'all do know because it was such a big part of our life. But I want to tell y'all about my children's diagnosis of leaky gut and what that meant and what that looked like and how it was healed. And then what we're doing proactively for our baby and the resources we've come across. One of the main resources we've come across for him. And that was actually a home test that's super easy to do. And I actually have a discount code for that if y'all are interested. I've already given that to people and they've already used it, and that's been super cool. It's a really good resource. So it's also crazy because, like I said in my first post, I find myself talking about this all the time. Just in normal conversation. It's like, oh, my baby has this. Oh yeah, my baby has that too. Or my baby had that. Well, why don't they have it now? Well, let me tell you about this crazy thing that happened and what we did for a year or whatever. So I think that gut issues and a lot of symptoms that you wouldn't consider gut issues that a lot of children nowadays have are all related to their microbiome. And that's something that some people know a lot about, it seems like, and some people don't know anything about, and it feels very out of their wheelhouse, and that's where I was too. But yeah, I just feel like it's a bigger issue than people think. I think a lot of our little ones nowadays deal with issues related to nutrition and gut issues, and that possibly some of these, I've seen a lot of these symptoms resolve when the gut is addressed. And so that's a really big deal for me. And it kind of goes along with my job as a pediatric physical therapist working with kids. The conversation goes there all the time. So yeah, I think this is a very necessary topic. So first of all, I'll tell y'all a little bit about our own journey. So when my son was between 2 and 3 years old, he started developing issues with almost every body system. For instance, he had trouble falling asleep and staying asleep. He had eczema. He had toe fungus and warts, and he was an extremely picky eater. He had sinus issues. He was on medication for like seasonal allergies and stuff like that. He was constipated. They told me that was normal for a breastfed baby, but now I know it's not. But even once he got on solid food, like I could not potty train him. His regulation, we know babies don't really regulate for a while anyway on their own, but very dependent on the passy and nursing, way more than normal. And he had retained primitive reflexes. And I think the biggest issue was the behavior. He just developed this like hairpin trigger and had these sensory meltdowns like multiple times a day, which is different than a temper tantrum, right? Temper tantrums like front of the brain, I want something and I'm not getting it and I'm gonna manipulate. That's normal. No, these were like sensory meltdowns. The reptile brain was just on fire. He was in fight or flight. It was just, and honestly, it was making lots of different things difficult for us with the behavior. It was out of his control. And then he was between 2 and 3, so we got to the point where he was saying, Mommy, I have a headache and I have a tummy ache. And then it was like, whoa, like that's totally corresponding with your behavior. And then we have all these other unrelated symptoms. Yeah, and so it just kind of hit a head where life was becoming a little dysfunctional. I had a newborn at home along with that, and his pediatrician was, she sympathized, but there wasn't much she could say about what was going on because everything was unrelated. Skin, sleep, digestive issues, behavior, things like that. So my mom actually, was watching this from the outside in, and she was like, maybe you should try something different. Maybe you should get him tested by this homeopathic doctor that a friend of ours, Jenny, had used for years. So she's like, why don't you just try that and see what's going on and I really needed that push, I think, because I was totally in it, dealing with it. And I also wouldn't probably had ventured that far without that boundary kind of being, that barrier kind of being removed of someone saying like, hey, I think this is the right thing to do. She even was like, hey, I'll pay for you to get this test done, type of thing. So, because I'm a clinical doctor, I went to school for a very long time to work in the Western medicine world, in healthcare, but we had to take gen med and nutrition and pharmacology. So that's where my mind was. It was really hard for me to shift to something like a homeopathic program. Even when I committed to doing it, it did. So that's not everyone's answer, but this is what led to my son being healed. This was like our answer to prayer. Okay, I see you, Lori. So yes, I did get him tested. I didn't really know what to expect because I knew her program from knowing friends who had done it. She focused heavily on the gut, and I was like, my son doesn't have really gut issues. He has some constipation sometimes, but I wouldn't have said he has gut issues. Like, his nutrition's fine. He's never had candy. He's never had juice. He eats mostly organic food. He takes his vitamins. But now I know there's so much more to that. There was a lot of things that he was getting that was upsetting his gut and all that. So yeah, I didn't think it was really going to help. So we got him tested, and actually his test results were so like off the chart, with inflammation, with leaky gut, with he wasn't absorbing any of his nutrients, like all these things. And they were so bad that the homeopathic doctor like expedited the results in the treatment program so we could get him started like ASAP, which was really hard for me. So yeah, we did almost a year. It was about 10 months, I think, of an elimination diet, reintroducing foods through that time, and homeopathics, herbs and tea and vitamins and minerals and supplements, environmental changes. I mean, we did everything for about a year. And that is like how the Lord healed my son. That we started seeing changes like in a few weeks after starting that program. He potty trained and didn't need a passy anymore. After a few months, he was sleeping through the night, which was big for us. Our family literally has like PTSD from not sleeping for years, through the night. And and by the end of the program, even his behavior had normalized, and that was just so big for us. And it was really cool for me to see natural remedies actually work in a way that Western medicine just wasn't doing it. There's a time and place for that, but that's not what was going on with my son. Side note is he is not actually allergic to any food. Like, we did an elimination diet, we did all this stuff, but he's not actually allergic to anything. He's not lactose intolerant. He doesn't have celiac or anything like that. He had just sensitized to everything because his gut was in such a poor state that he wasn't able to process any food really well. And so that was what we were dealing with as the root cause. So what we did was treat the root cause, not just the symptoms. And whether you're, no matter what type of doctor you're with, if you find a functional medicine doctor for your child or you're brainstorming things on your own, I think it's really important to look at root cause. So that was the premise of this program, was taking out foods that were offending and causing inflammation, and then putting in the homeopathics and the herbs and all that in order to heal the gut, because otherwise you might be able to get back on those foods for a little bit, but then you would have to take them out again at some point if you did not heal the lining of the gut so that the intestines can actually absorb the nutrients and eliminate the toxins. So that is what we did. I actually have before and after pictures, pictures of right before we started this program, and a month and a half later, my child looks like a different kid. We didn't realize it, obviously, seeing him every day, but his face was swollen. Like, his lips were swollen, his eyes were swollen, and he just had so much inflammation in his body. It was wild. And so to see the change just from, you know, taking certain foods out and healing the gut, it changed everything else about his body. And so I've known a few other children who have done this program, and they've had, you know, their root cause might be a little bit different or whatever, but treating the root cause is really important. So if you're having issues like that with your little one, if that's kind of resonating with you, that would be my suggestion, is to try to look at the body as a whole, and understand the role of the gut microbiome in regulating the immune system, regulating the hormones, and everything else. That's really important, because we can't really, as parents, we can't really parse out, you know, well, my child is, you know, not having these, you know, actual gut symptoms, so I can feed them whatever I want. You might be seeing another symptom that you don't think is related to that, but it is. That was the biggest eye-opener for me. And when I talk to parents, they're like, that makes so much sense, because, you know, once I got them on this food, then the symptoms started or whatever. So, yeah, it was really cool to see natural techniques heal him from the inside out. And we've, you know, he had carryover from that. You know, the healing that we saw a year later, we tested again for another reason. They wanted to actually remove his tonsils because they got inflamed once we moved out here to the farm. He got very congested and stuff. So we actually did the program again, and all of his old symptoms, they had not returned. All his numbers, you know, were where they were when we finished, which was really cool for me. Like, the issue didn't come back. As far as the leaky gut, you know, didn't return. His inflammation in general, his cortisol was still low, like all that. But 10 weeks into the 22-week program, the second time, when we were treating his tonsils and immune system specifically, his tonsils were back to normal size, and we avoided a surgery. And I was like, man, like, I understand some children, when it's an emergency, you have to get those removed so they can breathe, you know, when they're sleeping and things like that. But it's not always the answer, you know. There are other things you can do before removing part of the lymph system, you know. When you're kind of in that, okay, it's not an emergency situation, but we're having a chronic issue, you know, I would just encourage parents to, again, go back to the root cause and say, okay, what's causing this, and how can we change our child's environment and their, you know, their intake to allow their body to heal itself, because the body will heal itself in a typical child. And so you kind of have to trust that process and trust the Lord, honestly, to say, you know, I'm gonna make these changes, and I'm gonna make some hard decisions about their diet or their lifestyle, whatever, and let this child heal. And so that's what we saw. So your big question might be my big question. How did that happen? How did that happen to my son? That was like the first thing I asked her, because I was so literally like anal about what he ate. My husband would laugh because I thought I was being very, you know, clean with his diet, and I just was not. But I didn't know it, because when you're just buying off the grocery shelves, you know, things just sneak in. So my question was like, how did it happen? And she said, well, because of his age, the homeopathic doctor, because of his age, he's between 2 and 3 years old. He's only been on solid food, you know, for a year to two, you know, year and a half, whatever. He most likely inherited it from you. So from my gut, from, you know, exiting the canal, from breast milk, he inherited yeast, candida, you know, that yeast overgrowth that can colonize in the gut. That bad bacteria that can block the action of the good bacteria. You know, when people talk about yeast in the gut, it's normal to have some, but there's an overgrowth of that candida. I was actually tested after that, and that is exactly, we had a very similar profile. So it got inherited. So that's, I think, really important for moms to know is that, you know, if you're having issues with your own gut or immune system or eczema and stuff like that, it's really cool that you can affect your baby's health by addressing that. And there's so many things that you can do. And you can do that while you're breastfeeding, and you know, they will get the benefits of that too. So anyway, that was kind of the cause. The underlying cause was he just kind of inherited a lot of yeast from me. And I guess maybe if anyone's interested in another video, I can go into why that happened to me. You know, because a lot of people don't realize, you know, they're going down a certain medical trail, taking antibiotics for different things and all that, what that can do. I mean, I wish the doctors would tell more women that. Then they go and get pregnant and they have all these issues. But anyway, with that underlying issue of the yeast, he, once we got on solid food, the food wasn't necessarily, not all the food was bad, but it was exacerbating the inflammation that was already there in the gut. And that's what leaky gut is the lining of the gut is compromised from either killing off all the good bacteria by things like antibiotics, or never properly colonizing. Like if a baby is born via cesarean and they do not exit the vaginal canal and they're not exposed to all of that, that's a reason. Yeah, Nikki, I think you're talking about women's microbiomes before pregnancy. That's a really cool topic too. So yes, there are many reasons that leaky gut can develop. But essentially the lining is full of these little hair-like structures. The hair-like structures are supposed to absorb all the goodness into the bloodstream and keep out toxins. And the toxins should stay in the intestines and exit the body. But when the lining of the gut is compromised, either by an overgrowth of yeast or good bacteria being killed off, or foods coming in that have a lot of, say, like canola oil and substances that are unstable or rancid, you know, you hear about all the free radicals and things like that, that totally messes up the balance between the bacteria, the good, the bad, the opportunistic bacteria in your gut. So when the good bacteria is outweighed by the bad, then the opportunistic bacteria that kind of just sit there neutrally just proliferate. So then now you're in a cycle of the lining of the gut not being able to absorb the nutrients and not being able to keep the toxins in. So not only are you just like losing, you know, most of the nutrients are just exiting your body, but then toxins are able to get into the bloodstream. So that's where I think everyone's like, leaky gut's a myth because you can't define it. But really it's just kind of a catch-all term for the lining of the gut being compromised. Now, it's going to look different in everybody because we all have different genetic predispositions to certain things. So your leaky gut may actually be gut issues. Like if you're, you know, a lot of the bacteria in your actual colon was compromised, then, you know, you might have a lot more constipation issues or bloating and things like that. Where other people are like, I don't have leaky gut because I don't have any gut symptoms, but it might be coming out as eczema or dandruff, not caused by dryness, but caused by like malassezia, you know, is a type of fungus, but is connected to that. And, you know, it can even affect hormones. So people are like, I don't have any physical symptoms. I'm anxious and I'm foggy. And it just depends on your chemical makeup, what your body is prone to, like genetically or because of your environment, how that leaky gut is going to come out. And that's why it's so hard for people to sometimes accept and treat. But what's cool about that is it's the same root cause. So my daughter actually has the same issue. I had her tested when she was a little bit older. She didn't have as many issues as my son, but because I knew that he inherited a lot of yeast from me, obviously I hadn't been treated for my yeast issue before I had my daughter. So I was like, oh no, we're gonna do this again. Here we go. But it actually wasn't as bad because my diet was a lot better when I was pregnant with her. And I actually took real vitamins when I was with her. Like when I was pregnant with her, I was more nourished. I was more, I was taking in a lot more real nutrients and stuff. With Joel, I ate so horribly. I mean, we had just like bought a house. We were like living off of like, it's just crazy. We did not eat well. We did what we had to do. And because I was so unhealthy, I couldn't even tolerate a real vitamin. I had to take like Flintstone, sour gummy vitamins because that's all I could stomach. But that's telling, right? Your body should be able to handle a real vitamin. And if you're taking good quality vitamins too, good quality vitamins shouldn't really make you sick. So with Claire, I did better. So I think she was naturally a little healthier, but also by the time she got on solid food, we were doing that program with Joel. And so she ate a lot more whole food and things like that. So anyway, she does have that underlying gut issue. We had her tested fairly recently because I couldn't potty train her. It was similar to Joel. She had digestive issues from day one. So she did kind of have a similar issue, just not as severe. And that was really cool too, because if you look at what should have happened, she shouldn't have been as affected, and she wasn't. And so all of it kind of confirms each other. And like I said, I got tested as well for my gut issues and inflammation, and it all just makes sense. They had kind of, gotten that from me. And what's cool is we're about halfway through Claire's program, and she is potty trained. Like, she just needed the homeopathics to help with the actual symptoms, but then the teas and the herbs and stuff and the specific probiotics to balance out her gut and get the yeast out of her gut so that it could function normally. So we're already seeing like improvement with that, and that's super cool. So that's kind of the backstory about what we went through as a family. That was a huge lifestyle change, and it really did save our family. Like, I'm around a lot of children, so it's like, oh, your kid was throwing tantrums. No, it was a lot more dysfunctional than that. And, not to tell all of his story, but, yeah, I mean, that's something that I think a lot of families deal with, and they might deal with it quietly. These behavior issues that are more than just tantrums, but it could be kind of like my child, that your child is sick. No, there's not like a huge medical condition, but their body is out of balance. And what's cool about that is you can do something about that. And so I'll talk about that a little bit more at the end. But now, like I said, I have conversations about this with many, many people. And now we have a baby. We adopted a baby. So going through all this, knowing that we were going to adopt a baby at some point, I was like, man, if I, as a fairly intentional, like healthy mom who was, freaked out about a lot of things and tried to do all the right things during pregnancy, if that happened to my children, we do the best we can with what we know. When we adopt a baby, it's fair to assume that that birth mom would have gone through things that would have made it hard for her possibly to be healthy and to be as intentional, and things like that, right? Like, and that ended up being true. Our baby, his birth mom made a lot of cool decisions for him, and a lot of good decisions on his behalf. But I don't have a lot of medical history, but the medical history I do have, I know he is at risk for leaky gut, to say the least, and other issues, related to that. So I wanted to be really proactive with this baby, knowing what I know now, looking back with my other two. And so when he came home, we had like 24 hours to get ready for him. So it wasn't like day one, but as soon as I could get it in from Amazon, we started him on probiotics and vitamin D. And any baby should be on probiotics, infant probiotics. from the research I've done, babies get some probiotics from mom if you are taking like a full dose consistently of probiotics yourself. But there are infant probiotics. And then vitamin D is recommended if babies are drinking less than 35 ounces of milk a day, which is easy when they're formula fed, because you know that. You may not always know that when you're nursing, but just as a, a gauge, my baby's almost 5 months old and he's not quite even drinking 35 ounces a day yet. So most babies need that. So we got him started on that, but his immune system, I wouldn't say he's immunocompromised, like medically, but he has already caught like 3 viruses. And like, my kids aren't even in school, like we're homeschooled. So he just catches things very easily. So at 2 weeks old, he was on antibiotics with an infection, which was devastating for me because everything I just said, antibiotics are not good for the gut. Thank the Lord that we have antibiotics when we need them. Like, that's a miracle. Let's, use them when we need them to avoid serious issues, but they're not good on the gut. Like, you have to heal your body after you take antibiotics. And my 2-week-old was on them, 2 of them, and an antiviral, because we were in the pediatric ICU for an issue, him being sick. So I'm like, okay, I want to make sure that I'm being really specific with how I'm healing him. I don't want to just like take a shot in the dark and give him over-the-counter probiotics. I want to make sure he's getting what he needs, what he's actually deficient in. I want to give his gut what it needs. And I came across Tiny Health. I'm not an ambassador for them or anything like that, but I do have a referral code because that I'll share with y'all, because I think this is the coolest thing ever. I just told y'all about the 1-year program I did with my 3-year-old, which is super cool. If anyone is motivated and they want to do that, that's great. But my thing is, if you can avoid that, that's also great, because that was really hard. My husband's watching now, so now I feel like you can chime in, Josh. But if you can avoid doing that with an elimination diet and 3 times a day treatments of tea and homeopathic drops under the tongue and all that, it would be good, right? So what I came across was this Tiny Health home test, and it's marketed for babies, but literally anyone can take this. It's just, mainly marketed toward babies, because the science shows that first 3 years of a baby's development, how the gut develops in that time, kind of sets the stage for the rest of their life, their immune system for the rest of their life. Of course, there's things you can do like we did, but now, we're on the front end trying to be proactive. So this was a stool sample test that you mail in, and they are able to give you results. And they were able to tell me exactly which strands of bacteria were in my son's gut. How cool is that? The good and the bad. And not only that, they gave me an action plan. Like they said specifically, this is what he needs in his diet. And they even went so far as to give more general recommendations, like getting him outside and putting him in the dirt will help him, which is easy where we live. So we're doing quite a few things to, bolster our baby's immune system and address his gut health. But this was the first thing that I did. And I'm really glad I did, because the over-the-counter probiotic that I had him on, it wasn't bad, but it did not have the actual bacterial strain that he needed. It wasn't the probiotic that he needed. Every brand has different strains of probiotic bacteria. And he was deficient in one, and that's not the one he was getting from what I was giving him every day. So that was cool. I was able to be more specific. So how this works, they send you a box, and they send you this really easy to follow instructions, this little booklet, just super easy. And this had a swab in it, and a little vial to put that in, and then there was a QR code, so you can scan the QR code and do a questionnaire for them to let them know all about babies or your medical history if you have it, and the symptoms they're having or whatever. They really advertise this for eczema, but it's literally for anything. They go very in depth with their questionnaire. So then you send that in to them, and it does take a while. My homeopathic doctor takes a while, and this takes a while. But then they have doctors that seems like functional medicine type doctors like on staff, and they analyze the results and they send you a really personal, like individualized breakdown. And yeah, so I wanted to kind of show you what you get when you do this. So especially for moms who are kind of nerdy like me, this is super fun. So it goes from really general to really detailed. So at the top, it just gives you literally like a percentage of these things were good about his results. These things were normal. These things need a little bit of help, and this one really needs to be addressed. So you can just like look right there and get, you know, the most general breakdown of this is what's going on in your baby's gut. So then when you come down a little bit, it becomes a little more detailed. It tells you about all the beneficial microbes, all the disruptive microbes, about his short chain fatty acids. So especially if you're on formula, I would love to talk to y'all about formula and how to make maybe better decisions about what formula you're giving your baby. But that's a big one with that. Digestion and absorption markers, which like I said earlier was a huge issue with my son, right? He wasn't hardly absorbing any of his nutrients. Even though we were feeding him good food because his gut lining was so poor. So like this is why it's really important to look at this. And then it even gives you a gut type, and you can read a little further on that. So after it gives you the general results and the results by category, then it gives you an action plan. So then you can come on here, click on take action, and it will say baby needs a probiotic, and then it needs to be a probiotic with this strain. Here are all the brands we recommend that have this strand and that have been researched. What's cool is Tiny Health does not sell probiotics, so you don't really feel like you're being just like sold to. Like, have you ever done a home mold test? I did that one time, and it was a total ripoff because what they do is you do it and you send it in. They're like, you have a house full of mold, and we can also come clear your house of mold. That's just a side note. That happened to me one time. But this isn't like that. So they don't sell any probiotics. They just do the testing. They offer an optional consult call with the doctor, which I just take these results and I go to our homeopathic doctor with them. But they give you literal products that you can choose from and that have the exact strain of probiotic that your baby needs. And so it takes the guesswork out of it. So for my baby, for instance, he is on formula because we adopted him. And so he wasn't getting a certain prebiotic that is really important. Prebiotics are what the probiotics feed on in order to get strong and do their job. So we get pretty much, if you're having a pretty normal diet, you're getting prebiotics from your food. But you can also supplement prebiotics. Pretty much they're like certain types of sugar. But there's a certain prebiotic in breast milk that isn't in my formula. Some formulas do have this prebiotic called HMO. It's called human milk oligosaccharide, and babies really need that for any probiotics to even work. And I didn't even think about that. But so my baby is on a European formula that's really minimal with their ingredients, and they don't add that in, which is really the only con. So, but they were able to show me a brand that had both the prebiotic he wasn't getting and the probiotic strain that he was deficient in like one little powder. And so I'd never heard of the brand, but it's a medical brand, which is even better than some of these, you know, just popular brands on Amazon or whatever. And I saw a difference after him being on the probiotics with his digestion and stuff like that. So I really recommend, if you are having or even think you're having issues with your little one, with things like eczema, sleep issues potty training, obvious gut issues, then consider looking at their gut, even if it seems like it's unrelated, because that totally changed our life. So this test, I'll put a link to it under this video, and also a link to their science page where it kind of talks you through how it tests. So a lot of gut tests that you buy take a tiny sample, but they're only looking at, like, you know, they're kind of like looking at your gut through a microscope, whereas the testing that this company does is able to give you a very well-rounded look at what your gut is, and it explains all that. So I'll put a link to that, and a link to where you can buy that, and also a link to a code that you can use to get $40 off. Also, I don't know if you can combine codes, but there is, if you go to just their website, you will get $15 off your first order. But if you can somehow find the ad on Instagram, you get $20 off your first order. So if you want me to ever tag you in that, they are on my Instagram feed all the time, because that's all I do is talk about them. But I can tag you in it if you're interested, and you can try to combine them. But you can get $40 off with this referral code, and it gives me $40. So I'm going to test John again, my baby, around the time I'm going to get him on solid foods. So, you know, we both get like $40 if we do that. So that's super cool. My friend Jenny that I mentioned earlier, she actually does pediatric pelvic floor physical therapy and does a lot of nutritional counseling for kids. And she went to a continuing education course, and she met the founders of Tiny Health. And they, you know, explained their whole testing procedures, and all that was super cool. So I really like this brand. And I really trust this brand, and I think it will be really helpful to a lot of y'all. Yes, I'm looking at Jessica and laughing, because we literally had this talk in the bathroom, like while we were going to the bathroom the other day in our co-op. It was so funny, just about gut health stuff and symptoms and babies and what you can do about it. So, yeah, if you have any questions about any of that, yeah, I'd be happy to answer it. And if it's helpful to hear about resources for your baby's immune system, or physical development, or their gut health, I have a lot more types of things like that. You know, we're doing a certain weaning program, you know, that includes a lot of like bone broth and probiotic juices for our baby. We're doing introduction to allergens really early with him using a certain program, and everything is going really well. So I don't have a lot of fruit from that, you know, like he's not on solid food yet, but I'm trying a lot of these cool things, and this is something I've already done that's worked really well. So if y'all are curious about any of that, we can do these again. So if you want to talk about anything specific, just let me know, and I'll put those links down in the bottom. And I appreciate y'all watching, and I will try to come on later, maybe in a week or two, and do a similar one. So I hope y'all have a good night, and thanks for watching.